Welcome to the James Cooley Show. It's your life. I'm your host, Dr. James J.C. Cooley. And wow, we got an absolutely fantastic show today. And we're going to be talking about a topic that I think it's of interest to anybody that go to the doctor. I mean, because when we go to see our doctors, it's we going in hoping that the doctors kind of have a little sincere for us, not just getting us in and out of the office, but also, putting the patient first. I'm talking about first in not just from a medical standpoint, but also from a mental standpoint, because we would not be seeing a doctor unless there was a problem. So, but that's what we're going to talk about. But I tell you what, I can't do anything without bringing my executive producer and co-host, Dr. Michelle Denise Cooley. How are you doing today?
I'm doing good. I'm really excited about the topic today. I think everyone has been through that where, they feel rushed, or maybe you're not hearing, the doctor's not hearing what I'm saying, but we have great two experts on the show today, returning guests who are going to be addressing this topic.
We got two experts that's going to be talking about this. And I tell you what, audience, wherever you're watching this at, whether you're watching on E360 TV, YouTube, LinkedIn, Twitter, or over 25 other live streaming networks, all you have to do is just go to the comments, ask any question that you want, and I promise you we're going to get you some answers, because we are going to have fun today. Michelle, can you please tell our viewers and our listeners the title of the show, the purpose, and introduce these two great doctors?
Oh, yes. Well, the title of the show is Healing with Hospitality, Putting the Patient First. And the purpose of the show, we're going to have a discussion with cognitive behavior coach, keynote speaker, author, and advisor, Dr. Michael Mantell, and integrative cardiologist, Dr. Melody H. Hermel. We're going to talk about why half of Americans think there's a lack of compassion in their healthcare providers, and how 63% of healthcare providers state compassion has declined in the last 5 years. We're really going to talk about the reasons behind this, why healthcare providers claim, believe, think that they don't have time to express compassion. It's very interesting. So our returning guests, I'm just going to summarize, their bio, but there are so much more than what I'm getting ready to say. Dr. Michael Mantell, nearly 50 years, he's been helping people of all ages and backgrounds to serve themselves less and create lasting positive change with his compassion-based, rational, emotive behavior coaching methods. He's a member of the Science Advisory Council of the International Council on Active Aging, longtime member of SAG, AFTRA since 1981, through which he has brought psychology to the public for decades in broadcast and print media, including Good Morning America, Oprah, Larry King, Men's Health, and many, many more. He has written to date nearly 80 columns for Arianna Huffington's Thrive Global on emotional education through COVID-19. He's written 4 books, including his first in 1988, Don't Sweat the Small Stuff, P.S. It's all small stuff. So welcome back, Dr. Mantell. Welcome back.
Always a pleasure and privilege to be with you. You're the A team in broadcasting. It's great to be here.
Well, thank you. And we also have returning Dr. Melody H. Hermel. She received her MD at Tufts University School of Medicine in Boston, Massachusetts. She completed her internship and residency training in internal medicine at the LA County University of Southern California, Keck Medical Center in Los Angeles, California, and her fellowship training in cardiovascular medicine at Scripps Clinic in La Jolla, California. She also completed fellowship training in integrative medicine through the Academy of Integrative Health and Medicine and a healthcare musician certificate through the Public Music for Medical Environments training program in Boston, MA. As an integrative cardiologist, she combines traditional and alternative approaches to treat high cholesterol, high blood pressure, coronary artery disease, cardiac arrhythmia, congestive heart failure, and women's heart disease. We're bringing back Dr. Melody Hermel back to the show. Welcome, both of you.
Thank you so much for having me back. So excited to be here.
Wow, this is going to be an exciting show. I cannot wait to get started. So first of all, I want to know why both of you collaborated together to come up with this topic. Can you tell our viewers and our listeners? We'll start with you first, Dr. Mantell.
Well, first of all, it's always a privilege to be able to talk with Dr. Hermel. Melody is a compassionate and brilliant integrative cardiologist and just a wonderful human being. So when the topic of compassionate healthcare, putting patients first, healing with hospitality popped into my mind, I thought, Melody, you're the one. We know from rigorous research that has been done over the last several years for the pandemic and since, during and since, that when healthcare providers take the time to make human contact to help end suffering, patient outcomes improve and healthcare costs go down. And we're going to dig into that in a major way. But another finding is that physicians' burnout decreases as well. And so from all of the research that I've looked at and that Melody's looked at, we know that taking the 40 seconds, which is all it takes, to be kind, to be empathic, to listen, to be supportive, that improves patient adherence to medication, to treatment. And it saves, the estimated cost is between $100 and $300 billion annually in the United States, just for 40 seconds of compassionate care.
Yeah, absolutely. Yeah, I want to start with a little bit of a story actually that I think really, makes me so passionate about this topic. So I'll give you an example. I had a patient who called me Friday right before the weekend. She was having chest pain and she had gone to see her doctor, got an EKG, and there was some subtle, finding on there. And she received a phone call and was told this could be nothing or this could be a heart attack. And, imagine being told that, and we have to do more, but it's about to be the weekend, and she was left with that information. And she, eventually got connected to me, a friend of a friend. And, we talked. And I think just, when I picked up the phone, she was crying and, just felt like she hadn't really received enough information. And just being able to partner with her, provide some compassion, listen, try to work with her, let her realize you're not alone. We're in this together. We're going to sort out what's causing your symptoms. We'll get answers. You're not, I'm not just going to tell you this could be a heart attack and then leave you on your own to sort that out. So I think it's just so important to look from the patient's perspective. What are they being told? How are they hearing it? What tools do they have to deal with the information you're giving them? And I just think it goes so far in the care we can provide. And it's so important. And I know, especially with her, what a difference it made to her.
Dr. Cooley, I'll share something with you. There's research that shows that 87%, that's almost all, but 87% of patients believe that kind treatment is the most important consideration in choosing a healthcare provider. More important in the research than wait time, than travel distance, and even cost. So if I asked you, which doctor would you pick? A physician who's kind and warm, or one who's cold, but graduated at the top of his or her class of medical school? You can see that 87% of Americans who ask this question say, we want kind treatment. I'm reminded of another story. Back in 2007, I think it was, there was a head-on bus collision in Sweden. And I think 7 people were killed. Now, they followed the 56 or so survivors. And 5 years later, they asked these people, what do you remember about the accident? You know what they remembered? Among the survivors' most distinct memories was a lack of compassion from the caregivers at the hospitals. 5 years later, that's what stood out in their heads.
Yeah, I know, I'm a physician. Obviously, I've personally been a patient. I've had family members that are patients. My children have been patients. And it's true. You really remember, how you're treated, how you're made to feel. And especially when it comes to issues such as our health and heart health in particular, we know heart disease is the #1 killer, very, very serious when somebody's coming in with, any concern regarding their heart. it's huge concern to a patient, to their family. You know, every person you see is part of a family network. They're not just an individual patient in front of you. They're a mother, a sister, a daughter, you know, and we really have to keep that in mind. And the fear that someone's experiencing of what could be going on, you know, and the words that I choose to say and how I'm communicating that information to them is so important. So, you know, I know we all know this from our own individual experience, what it's like being a patient, but it's important from the physician side that we remember that too.
Wow. You know, so more than 63% of the healthcare providers say compassion has declined over the last 5 years. Why is this happening, Dr. Mantell?
Why is always a question that we can have some trouble with. Why is the sky blue? It's a two-part question. The first part, why? Who knows? The second part, is the sky blue? Yeah, it's very blue. So why is this happening? We can come up with many theories, which we'll discuss in just a moment. But is it happening? More importantly, yes, it is happening. Let me explain. From early, the research tells us that from early on in medical school, even in the first year, empathy amongst the students, and Dr. Hermel, the physician amongst us, can attest to this, begins to decrease. What are physicians taught in medical school? Don't connect. Don't get too close to your patients. It'll affect your ability to be, objective. And we know now that not only does it not do that, but it harms the relationship, it harms the care of the patient, and it harms the physician. Melody, I wonder what your thoughts are about why you think it's happening.
You know, it's interesting. I know when you apply to medical school, we all write our personal statement, and you look back at people's personal statements, and everyone wants to be connected, and they want to care for the patients. They want to take care of people. You know, we come in with a lot of compassion. And it's true, something happens over the training, you know, and is it something we're being directly taught? Is it indirect? Is it the sheer number of hours that we're asking students to work and the sacrifices that are being made in their own lives and with their families? What is it? One thing that we can put our finger on? I think it's probably a host of all of these different factors combined, but certainly, you know, there's declining compassion, and we need to do more to increase our empathy. And I think there's, you know, significant amount of burnout. If you look at the studies, you know, I think they say 65% of doctors report burnout. And it's just, you know, the numbers are outrageous, and we need to figure out, what do we do to support the physicians? What do we do to improve the relationship between physicians and patients, you know?
Wow. You know, we got to take a station break, but this is so interesting. I cannot wait to get back from the break. If you want to be part of this conversation, all you have to do is go to the comments on the platform that you're watching it at, and just put your question in. I promise we'll get you an answer. Remember, it's your life. We'll be back shortly after the break.
I never wanna leave. Yeah, I'm right where I wanna be. It's something you and me. And I can't get rid of this feeling. Just like a magnet, we're just like a magnet. The things we have can be taken for granted. Now I know that it has always been you. I can't help it, I'm so drawn to you. Just like a magnet.
James Cooley. I am the founder and CEO of the J.C. Cooley Foundation, Options, Opportunities, / the Choice Program. Our primary mission is to help build a foundation of our youth and young adults and communities. And we encourage everyone to dream big, think big, and be big at everything you do. And the way that you do that is, first of all, you got to believe in yourself. You have to believe in yourself. You have to know that you are here for a purpose. You also have to be able to step out your comfort zone and do things that you probably didn't think that you can do. Hello, welcome back to the James Cooley Show. It's your life, and just like we got these two magnificent doctors here that's educating us and telling us about patient care and kind of like courtesy with some of the physicians, because we know that, and I'm just gonna say this, we know a lot of physicians just get the patients in and out, real quickly. I mean, because they want to see a whole lot of them, but kindness and taking the time to make your patient feel relaxed and want to come to you and open up on whatever is happening. I think that is so important. So if you got a question for these two great doctors, by all means, go to the platform and ask them. So half of America, just like what you said 87% think there is a lack of compassion in healthcare providers. Can you guys provide some specific examples so that our audience can?
I'll give you
focus on that.
I'll give you two interesting studies. There was a study done in 2018 at the Mayo Clinic. Very interesting little quick study they did. They simply looked at how frequently doctors interrupt patients when patients are describing their main medical concern. In the first 11 seconds, the physician is already interrupting. And how long does it take the patient on average, they found, to describe quickly their main medical concern? About 30 seconds. So first of all, the physician is interrupting. There was a study done by the National Institute of Health at University of California, San Francisco, a number of years ago. Amazing study. They looked at the impact of kind, empathic, supportive statements, compassionate statements on patients' level of anxiety. Get this. For every compassionate statement the physician provided the patient's anxiety dropped 4.2%. So in an average 15-minute, whatever it may be, interview, the physician gives 3 statements of compassion, you've dropped anxiety by about 12% or so. Not a bad piece of medicine to reduce anxiety.
Yeah, and when we talk about anxiety, we know the data shows it's a huge risk factor for heart disease. The Intra-Heart study, for example, 25,000 people from 52 countries, and they looked at all the different risk factors: high cholesterol, high blood pressure. Stress came in as the number 3 risk factor, greater risk factor than diabetes, for example. So when we talk about anxiety and heart health, the two go so hand in hand. And, what starts what? Are you anxious? And then that's, causing you to have physical symptoms. Are you having physical symptoms and now you're having anxiety as a result of that? Or do you have both conditions and they're, just independent of one another? But regardless, the compassionate relationship that you can have with your physician becomes so important in treating that anxiety and getting, the stress in your life under control. I mean, we all have stress. It's really what we need to do is figure out how can we manage it. And if you're not comfortable even bringing that into the conversation with your doctor, how many doctors actually ask their patients, tell me what your current stress levels are, how is stress impacting your life? We often don't want to ask about that because then we're going to receive an answer and we need to be ready to deal with that. And not everybody, has the training or the time or the resources really to help patients with the stress factors. So, first step is we have to be willing to ask about it and listen and realize that this is really impacting our patients' lives. And then we have to have some resources to put towards it as well.
I tell you a quick example. A cardiologist, not Dr. Hermel, not even close, was telling a client of mine, a client, that he was too thin. Now, the physician could have said, tell me about your eating habits. How are you eating? Instead, the physician, the cardiologist, who knows about anxiety, I think, said, "You're too thin. You're gaunt." Yelled at the person.
Right.
Guess how many times the person went back to see that doctor? Zero.
I'll give you another example. My patients come in all the time and tell me, well, my good friend told me about this medication I should take. My hairdresser told me about this supplement. I know this person, from my church that recommended X, Y, and Z. And it's so interesting. They're taking medical advice, picking supplements and medications that they'd consider being on from trusted family and friends and community members, and not necessarily from their physician. So what is it that the trusted family and community members are providing that maybe the physician isn't providing? And I think we're really, hitting the nail on the head today. It's that compassion and that relationship. And you have to feel that trust, because why would you, listen to, obviously we come in with our years of training and our degrees, but you want to feel really that you trust your physician when they make a recommendation.
Research shows that patient-centered communication, which is the cornerstone of healthy health care, if you will, not sick care, but that this sort of communication results in a 62% higher odds of adherence to treatment. So I know that we've heard stories from Michelle. I'm not sure you want to share that story, Michelle, since you're up here now, being told, take this, and wait a minute, what? No, I'm out of here. But remember, the physician talks kindly with you. The research backs up 62% higher likelihood that the patient is going to stick with the treatment.
Yeah. I will share that story. I'll just summarize it. Gosh, long time ago, I hit my head against this metal thing they pull over in the stores. Anyway, I had the worst headache for days, and I went to my physician. It was a new physician. Told him my symptoms. Then he prescribed anxiety medicine, and I just was like, "This isn't right." I took it for one day. I was like, I don't need anxiety medicine. My head hurts. I banged it against a metal object. Someone needs to really look and see what's going on physically in my head. So I never went back to him. Because I felt that he thought that I was making this up. He didn't really take what I said seriously. It's one thing if I came and said, if I didn't hit my head, but I have a headache, but regardless, I felt that he just wasn't compassionate. He didn't take me seriously, and he just wanted me out the office. And that was the last time I did visit him. Actually another story real briefly. I switched doctors. I forgot why. This is so long ago, but same thing. I never went back to this doctor because he was just so stiff, so unemotional, and just so detached from his conversation with me. And I knew that was not the doctor for me.
I'll share a personal story similar as well. My daughter, one of my daughters had surgery when she was a baby, and we needed to get her to eat after the surgery. And I was really worried about her getting dehydrated, and I wanted them to give her more fluids. And I was up the whole night using one of those syringes, getting one drop of fluid in her mouth at a time, trying to get her fluid intake to be increased. And the doctor came in the morning, and, I'd been up the whole night, and I said, she's not drinking. We need IV fluids. What can you do for her? And he said, have you tried giving her any fluids? You're going to need to try, And I'm like, I've been up the entire night, one drop at a time. You don't assume, ask the questions, don't assume. But he said, you're really going to have to try, it doesn't. And so I think just, that for me, that always reminds me when I'm with patients, don't assume that, their situation. Really ask questions, really try to think from their experience, because, most people are going to be trying very hard. And by the time they're coming to you, they really are looking for your guidance and help. And, it's unfortunate because with system pressures, we can unfortunately have very limited time sometimes with patients and be under pressure to be in a hurry.
I'll tell you this, that there's a difference between treating patients and taking care of patients. And I think that sums it up so well. I teach that to a lot of the young people that in training that I work with. Don't treat, take care. It changes a whole mindset.
Yeah. I remember one of my mentors taught me, for every patient you see, make them a little bit better after you've seen them than, when you came in the room. And that's true, no matter what ailment they have, because at the end of the day, they're coming to feel better. So if there's some small thing I can do, to help them feel better.
Every patient wears a little badge right here. Says, make me feel cared for by, make me feel important by. And when physicians think about that, it changed. I just did a whole consultation with the medical office, and we actually printed them up, and we pretended we're patients coming in, and just to keep the doctor's eyes on that changes a mindset of the physician. Makes a difference.
You know what, James, and I don't know if you want to. We have a lot of comments on the show from viewers.
We're gonna take a station break, and then we're gonna come back. And there's a couple of questions that our viewers are gonna ask. But this is so exciting, and if you want to be part of this, wow, why wouldn't you? All you have to do is go to the platform that you want to ask these doctors any question you want, and I promise you we'll get you an answer. It's your life. We'll be back shortly after the break.
Really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave high school, you gotta know today or tomorrow, or hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create, collaborate, commit with confidence. Commit with what? Commit with what? And everything that you do.
Noah Dingley here, producer of The James Cooley Show, It's Your Life. And the new audio version of James' book, Country Boy, City Boy, A Journey That Ain't Over Yet, is a must-have. James shares his true life story of struggle and success in America. It's both a cautionary tale and a roadmap to achieving the American dream. Get the new audio version of Country Boy, City Boy, A Journey That Ain't Over Yet by James Cooley on Amazon.com or wherever audiobooks are sold.
Hello, welcome back to the James Cooley Show. It's your life, and this discussion is so intriguing. It's so important. It's so important, and it's just great having two great doctors here. Talking about all of these great things, and I tell you, I mean, I'm learning a lot. You all learning a lot, and we're gonna continue to learn. And just jump in, be part of the conversation because they're gonna bring it, and we got a lot more coming your way. We got a lot more coming your way. So I want to get back. First of all, it's a couple of questions. I think this one is for you, Dr. Melanie, with Dr. Goldsmith. Why do you think that the heart disease is the leading cause of death in the country for both men and women?
Yes, so we know heart disease, the number one killer in this country and worldwide. And we talked about this in our last show together. Unfortunately, that statistic is true because 90% of heart disease is actually preventable. So why do I think it's the leading cause of death? Well, so much of it is, based on lifestyle choices, based on social factors. We know the big risk factors for heart disease, the preventable ones. We know high cholesterol, high blood pressure, stress, as we talked about, diabetes, just to name a few. We know there's genetic influences. We know as we get older, it's a big risk factor. But I think if we had to pick one to really focus on, let's look at nutrition. Our nutrition is the number one determinant of our health. And too many people, in this country and worldwide are not getting healthy nutrition. We know in the US, 1 in 2 Americans has pre-diabetes or diabetes. There's big problems in the food system in terms of what food is available. There's, as we talked about on our previous show, social determinants of health in terms of being able to access healthy food and education. And so, I think all of these risk factors at play are the reason that heart disease continues to be the leading cause of death, even though it doesn't have to be that way. And what keeps me going to work every day to help, fight this.
Dr. Mantell, I think this question is actually for both of you all. Kendra and Bird, is how are physicians taught to show empathy to patients they may not personally relate to?
Well, I'll tell you, I spent quite a bit of time working with healthcare practices and teaching physicians this very topic. I'll tell you about a little gimmick. That is the doorknob. What I tell physicians is this: when you go into the room and you close the door, take a step back and let the doorknob hit you in the middle of your back. And people are like, why? Because that's a little reminder to stop, take a step back, observe what's happening here, understand how important compassion is, and then proceed. And so that's a fun little trick I have. Another one, of course, is what we just said earlier. Imagine that every patient you have is wearing a little sticker that says, please make me feel cared for by whatever, and make me feel important by. Physicians need to be able to ask the question, tell me what's going on with your family, as opposed to, this is the statistics, this is what the blood study says, take this medication, I'll see you in 2 weeks. Get to know the biographies. How much does the physician really know about a patient? So I think those are some things. It's more and more becoming a part of burnout prevention because we know that is an element. And so when you share the research and physicians' eyes open, they go, I didn't realize it only takes 40 seconds. And I can say something meaningful, supportive, empathic, and so forth, and reduce my patient's anxiety by 4-5%. I think physicians get this message more and more. And we're seeing that, 70% of physicians are employees. So the healthcare system needs to transition. When physicians have more control, they can rely more on what brought them to medicine in the first place. And that is, as Dr. Hermel said earlier, to take care of people.
And thank you for sharing those statistics. And I'll share some from the personal side. You know, having gone through medical school, what training did I receive? Well, I went to Tufts Medical School in Boston, and I'd say they're very forward thinking and really, you know, want to promote prevention and, you know, health. And so, for example, at Tufts, and this is pretty standard across medical schools, we would have practice sessions with actors. So they bring in actors who pretend to be patients, and we sit and, you know, interview them and discuss different topics and pretend that we're examining them. And they would actually grade us on how they felt, and if they felt that we were being compassionate, if they felt we were really listening. I remember one of my first encounters, I had asked a patient a question, and I guess it didn't come out sounding, you know, very compassionate. And she said to me, "Are you trying to make fun of me?" And I was, you know, I was there. I was a medical student. Oh my gosh, no, it must have come out the wrong way. But it did help me to gain some perspective of what am I saying and how is it being heard. And I'll also tell you, you know, I was actually a theater major in my undergraduate training before I went to medical school. And people always ask me, how is that connected to being a doctor? And I have to say, it was really some of the best training I ever had to be a physician. And I wish many of my colleagues could have that kind of training, because I was learning to work with my team. I was learning to read body language, you know, work off of each other. You're on stage, something goes wrong, and we have to figure out a way to make it look seamless where the audience doesn't notice. And, you know, also, what's the best way to really understand another person's situation? What could be better than learning to put yourself in their shoes, embody them as a character, you know? So really learning to think from other people's perspectives. There was also a doctor who taught me in my medical training, you should know which patients you don't like. And if you have that feeling like, I don't agree with this person, or, you know, I don't like them for some reason, know that and identify that, because then you can do everything possible to take even better care of them. You know, be aware of that feeling walking in the room.
I want to, Melody, you mentioned diabetes as an issue, of course, that you see in your own practice and related to heart disease and so forth. There was a study done that a Dr. Hojat, I think the name was, found that diabetes patients are more likely to have their disease under control if the physician scores high on scales of empathy. It's amazing.
Yeah.
A physician score correlated inversely with diabetes patients' likelihood to develop acute metabolic complications. Surgical patients, we know, heal faster and are discharged from the hospital more quickly when they're encouraged by the anesthesiologist during the immediate postoperative period. And, you know, I just think that no matter where you look, but I suspect cardiology in particular has a very focused connection between kind, empathic support and enhancing patient empowerment and a perception that it's going to be okay.
Absolutely. I think it all boils down to connection. You know, picture yourself, a patient had a heart attack. You're rushed into the ER. You have a team of, you know, 30 people swarming around you in the ER, and everyone's shouting out different words that sound scary. And you're rushed into the procedure suite, and we're putting a stent in the heart. And, you know, if you feel connected and you've got, you know, staff, whether it's the nurse or the doctor, whoever, you know, makes you feel connected, feel comfortable. I've received letters from patients, you know, after their heart attacks. They've written me letters saying, what I remember about the experience is you communicated with me every step of the way. You told me what to expect. You told me what was going to happen. You were there. And just the communication piece, the connection piece is so important, because it's very nerve-wracking to be that patient in that situation. And there's so much out of your control, right? You're not the one performing the procedure. Everyone's telling you what's about to happen to your body. And so feeling connected to the doctor who's doing this and feeling that there's communication happening, I think those things are so important.
I got a really interesting question.
Uh-oh.
I got a really interesting question. ERs, emergency rooms, doctors and nurses, whoever works in the ER, compared to working not in the ER, it seems to me that the public is made to believe that those who work in the ER have less compassion than those who actually, let's say, have their own practice or whatever they are in the hospital if they're not part of the ER. Do you find that those who work in the ER, because I have a cousin who used to work in the ER for over 20 something years, and he said it is fast paced, and it's a lot. So what are your thoughts on that? Have you heard anything about ER doctors or nurses? The compassion there may be a little bit trying. What are your thoughts?
I think you have to really look at the situation, all the different factors at play. So, in the ER, your job is to figure out, where does the patient need to go next? Are they suffering a life-threatening situation? Do they need to go urgently into surgery, into the hospital? Or is this not, something life-threatening? Can they go home? And you have so many people coming in and out the door, and the stakes are so high to make such a decision. Any mistake, that's somebody's life. So I think their job is so hyper focused on figuring out, is this life threatening or not? I tend to explain it to my patients like this. Oftentimes as a doctor, my job is to figure out what you don't have. You're coming in to figure out what you do have. You're experiencing chest pain. You want to know what's causing it. I'm meeting you, and at least in the immediate, urgent, emergent phase, I'm trying to figure out, is it a heart attack? Is it a punctured lung? Is it a blood clot in the lungs? Is it, all the list of dangerous things? And so I think some of this, obviously the way we communicate, the amount of time we spend, how much we listen, but some of it is also just understanding the situation. If the doctor's job and the ER staff's job at that moment in time is to try to identify who needs life-saving measures and who doesn't, that can also come across, as being non-empathetic, because here I am not really figuring out exactly what's ailing you. I'm figuring out what's not happening. And so part of it is just communicating about expectations, and I start in explaining that to people. Today, we're really working on this. This is what's going to happen over the next hour. So much of it is about just the communication, the expectations, the pressures that are on ER staff in particular. I know I've been on call, in the ER and gotten 15 new consults, and everyone's paging, everyone's calling. There's a heart attack over here. There's, someone's needs a pacemaker over there, and you're just running around all night. And so sometimes I tell people very honestly, I'm meeting you tonight. There's a lot happening at the hospital right now. I'm going to try to put out any fires, deal with any emergencies. And then in the morning, we're going to sort out the rest of the details. But it's really about the expectations. And I think if you lay that down ahead of time, then people are much more understanding to what the situation is.
It's interesting you picked that particular area, Michelle, because in the most current research on burnout, the number one physician specialty that burns out is the ER doctor.
Yeah.
We're gonna take a station break. We're gonna pick this up when we get back, because both of you guys have mentioned burnout, and we're gonna talk about that a little bit more after the break. But as you see, this is so important, and it's not too late to be a part of this conversation. Just go tell your comments and just ask these two great doctors any question you like. Remember, it's your life. We'll be back shortly after.
Fight again. And if you want my opinion, I'll let it take me away.
Life is a series of circles and cycles, phrases and stages. These experiences teach you the lessons of life. You can either ignore them or embrace them. Welcome to It's Your Life with James Cooley. James is a motivational speaker, author, military veteran, and founder of the J.C. Cooley Foundation. James is here to equip you to strive for greatness and overcome adversity. It's time to get you equipped today for the challenges of tomorrow. Now, here's the host of It's Your Life, James Cooley.
It's your life.
Hello, welcome back to the James Cooley Show. It's Your Life, and wow, I'm sitting back in awe because the way that you two are explaining a lot of these things, it makes sense. It makes sense that we all, first of all, understand a lot of things that happen in the healthcare industry, and we understand when your doctor might not be that kind. That does not necessarily mean that they're not a good doctor, but they have to learn over a period of time, So I want to pick it up with burnout because I noticed you guys talked about that a couple of times a few minutes ago. Do you believe that healthcare providers who are compassionate with their patients are less likely to experience burnout? If so, why? Let's go with you, Dr. Mantell.
Well, there's an inverse relationship. The more compassionate the physician, the less the burnout. And burnout is a tripod that rests on, that includes, I should say, emotional exhaustion, a lack of feeling accomplishment, and a sense of depersonalization. Like, I just don't care. I don't have the interest anymore. So yeah, there is definitely a relationship between more compassion, less burnout. And that's what I would say. I'm interested in Dr. Hermel's take on that.
Well, I think back to those nights when I was working 80 to 100 hours a week in my training and, nights on call, and you're exhausted, and I have young children, and you're trying to balance your family and your work and your research and, the equation that potentially can add up to burnout that so many people experience. And I will say, whenever I started to feel like I was on the verge of those feelings, I'd go to a patient's bedside and sit with them and talk and hear what brought them in and hear about their experiences and connect. And just like we've been talking about how important that connection is for the patient, I personally can tell you, I think it's so important for the doctor. When I feel really connected, it makes my job so much easier because now it's, I really care about them. I really do look after each patient, as though it's my own family. And it's true. It's very important to remain objective. And we talk about, keeping our emotional distance to have some objective, objectiveness, but at the same time, that connection is so important. So it's finding that balance. Because for me, I remember in my surgery rotations in medical school, just, waking up 4 a.m., getting into the hospital and everyone's in a bad mood. Everyone's rushing around. Everyone's shouting orders. And I'm trying to find myself in the middle of all of this. And I would go and sit with my patients. And I actually have a background in music. So sometimes I would go and sing for them and we'd connect and we'd talk about the music and just getting back to being human as a physician. In my training in the theater, every meeting we had to go around the room, say our name and, some fun icebreaker. And I think we need to bring those things into medicine too, because we are human beings and we have to take care of ourselves to take really good care of our patients.
The healthcare system is not a healthcare system. It's a sick care system. And it's a system where everything revolves around the system, right, not the patient. What you just heard Melody say was unbelievable. Let me break down what I just heard you say, Melody. That number one, it's about the patient, not about you. Number two, you don't infect them with your bad feelings. You talk with your heart. There's something we teach physicians, back to the earlier question, the heart, head, heart sandwich. First, I'm going to tell you something that's compassionate. Then I'm going to give you the news that you need to hear. And I'm going to close by giving you something compassionate. That's how people remember. And that's just what you just talked about, sitting at the hospital bed. Courtesy, consideration, that's what you're bringing to people as you describe this interaction. Compassionate care is not an optional extra. You give that to your patients. And this is, I'm not here to just to blow you up, but that's what you were just saying. And those are the elements of putting the patient first. And JC, let me ask you a question. When you give money to charity, who does that help?
Well, it helps. In my case, it helps the kids. It helps the recipient, and it also helps the organization that we give it to.
It also helps JC.
Oh,
right?
Look,
Don't you
yes,
feel good?
I feel absolutely fantastic when I give, and
That's the
especially
point.
when I see the results.
So when look, the system is broken for doctors. You ask average doctor, it's not me. Oh, I don't have. It's not. Oh, don't blame me. It's the system. The crazy hours, and it's all about that. No, I mean I shouldn't say no. It is about that. But when we help physicians take that step back, stop, take a step back, observe, and then proceed. Collect your thoughts. Remember who this is really about. We need to help physicians fight the system in which they are trapped. When physicians became providers and not healers, it broke apart.
Yeah.
Wow, we're down to the last 3 minutes of the show, and there's so many more questions I want to ask. But I tell you, both of y'all, could you give our listeners, our viewers, 3 takeaways that they should get from this great lesson that you all are teaching us? We'll start with you, Melanie.
Thank you. Well, I think first of all, as we were talking about, it's about communication, it's about connection, and about setting appropriate expectations on both sides for the patient and the physician. And, we need to make sure as doctors that we're taking good care of ourselves so that we can really show up and be there and block out all the noise and the system and put our entire energy on what's the next best thing for our patient, what will help them as a whole person, and make them a little bit better than they were when we came in the room.
What about you, Dr. Mantell? 1 minute or less.
When we help physicians become more mindful of what brought them to this magnificent career, this calling, when they wake up in the morning, let's remind them what they wake up for. Number 2, let's remember that this is about health care, not sick care. And 3, let's make this as personalized as possible. The old teaching of don't get too close, it's going to affect you and so forth is wrong. Let's teach about the importance of connectivity.
Why don't we do this again real soon? Because this is so good. It's so important. So let's plan on doing this again real soon. Because I think our viewers getting a whole lot out of this. I want to thank you, Dr. Mantell. I want to thank you, Dr. Melanie, for taking time to come on the show today. I'd like to thank Michelle for putting together another great show. Most importantly, I'd like to thank our viewers and our listeners for taking the time to listen to this show. We got a lot more of these coming your way, so continue to watch and listen. So I tell you, my department of always dream big, think big, and be big at everything you do. It's your life. We'll be back tomorrow, same time, same place.